Hello, friends. A very good evening to all of you out there. Hi, Bataina. Hi, Perna. Hello, Rak. Hi, Sadaf. How are you doing? Hi, Chin. Where is my partner in crime? How are you doing?
Oh, hello, Dr. Ali. I'm very good.
That's
And
great.
hello, everyone. Yeah, hello, everyone.
All right. So you can imagine what students are passing through and what they're feeling at the moment, right, Chin?
Oh, yes, I can definitely understand their feeling at this moment in
So that fear of unknown and that feeling, oh my God, what's going to happen? Would I be able to speak up? What would happen if I'll be silent? If my thoughts are going to be organized or not? What am I going to do in the labor ward prioritization? Lots of things in mind, and they tend to disturb them a lot prior to the exam. So we are here today to give you the confidence that whatever you have been practicing, you just have to stay calm. You just have to be cool. What would you like to say? Hello, Rak. Hi, Bataina. I hope you people are not tired. The ones who just reached out, the traveling have been definitely tiring. So I hope you all are fine. Before we just begin the chit chat, I would like to have from your side. Then me and Chin, we are going to take over to tell you that how you have to be calm in the last one day and give your best in exam. Rak, how do you feel? How is health, my dear?
Hi, Dr. Sidra. I am very unprepared. I've never gone to an exam so unprepared. I had food poisoning, severe food poisoning the day
Yeah.
before. So last week I was in the hospital 2 days. I went to theater. This week, 2 days, I had food poisoning. So my health has not been on my side. And I can tell you, I feel very, very disconnected and unprepared.
I
I'm just
totally
praying to God
understand.
that my clinical acumen is gonna be my positive my best tool.
Yeah.
And
And
I'm
that
just
does happen. The things which you have been practicing, the things which you're just working upon, they just come up into your mind because it's a clinical exam, more or less. So it's
I'm
not only
very
what you
worried.
keep on reading. So that definitely works, Rack. That definitely works. Chin, would you like to say something? Because, what we had been doing in terms of practice, that definitely works out there. And that comes out like spontaneously. What I need is confidence. Don't be shaky, Rack. And don't keep in mind that, okay, you've not prepared. Yeah.
Yes, but what happens if they ask me? I'm not worried about the labor ward station and the long case. I'm worried about the short cases. What if they give me I don't know, any station, like I don't know, lupus, or I don't know what they give me, and I blank out completely. What do I do?
I suppose again, Rock, like Dr. Ali said, it's very true because they have tested your knowledge. It is about communication and delivering that message across to the examiner and the role player. And again, like okay, if you are faced with some unfamiliar topic, for example, if you get the type 1 von Willebrand disease or
Oh my
something
God.
that you have never heard of, lupus nephritis, use the medicine maternal medicine template to tackle it, because at the end of the day it's about how you want to tackle the situation and the topic preconceptually, and what is going to happen antenatally in the first trimester, second trimester, third trimester, and then later on you progress on into intrapartum and postnatal. So use the basics. The basics are there. It might just a little bit tweak here and there. Okay, lupus nephritis, what can it happen? So you're worried about high blood pressure, you're worried about small for gestational age baby. So add on, throw in all those bits and pieces of information that you already know from your common maternal disease like diabetes or high blood pressure or preeclampsia. So there's nothing too difficult about that. So again, don't be just like, oh my God, I'm just going to give up because lupus nephritis, I have no idea about it, I have no clue about it, or von Willebrand disease, I've not heard about it. So it's a bleeding disorder, so you know something about bleeding disorder. So try to make a very educational guess and play very smart in terms of delivering that message across to the examiner and also to the role player.
Mm-hmm.
I would like to second Chen here, Rack.C. I know you guys from part 2 written and now it's the OSCE exam. Nobody is blank in anything. Yes, maybe there are certain topics you're very good and skilled in that, and you know, like 100%. Maybe there are certain topics you might be able to deliver like 70%, but there's nothing in which you are nil, provided you stay calm. You don't have to give up on a station. You have to say whatever is coming into your mind. And if it's not exactly as Chin is saying, lupus nephritis, but you know what renal disorder can cause. You know the pattern of the maternal medicine in terms of the effects on the baby, on the mother, then antenatal, interpartum, postpartum, and then you cover that up. When you know the sources to the examiner, that this discussion is from the Irish guideline, this discussion is from the Green Top guideline, this question is, you are having a reference of the NICE guideline, or for that matter, any TOG article. Mention that in the examiner Viva. That gives you a very, very good position in terms of scoring that, yes, it's a well-learned student. I would like to say another thing, please. Again, we have discussed it earlier as well, that if you are having a difficult station, which is a difficult topic, that's going to be difficult for everyone, right? Jen beautifully says that your neighbor would be similarly anxious. So don't feel that it's only you who is having the difficult situation, and it's only you who is having this, a difficult topic, unusual topic, or an alien station. You are the one. If you're going to stay confident, you would be better in your presentation and in comparison to others as well. This exam, for the Irish students, they're out there, or the ones who are residing in Ireland, but for others, it had been really difficult because of the visa things. Everybody had been traveling. So I expect that nobody is 100% prepared, and never in OSCE we are 100% prepared. It's only they want to see you head to toe that, okay, this person is eligible. We are analyzing how they carry themselves, how they talk. Obstetrics and gynecology is full of stress and emergencies, how they're going to deal and tackle with that. So they want to see you that, yes, you're not a nervous person. You don't have the lack of confidence, and you're the right person to hand over this degree. Do you people get the gist? So what I want from you guys is the peak of the confidence. No matter what happens, don't forget your general things like greeting the examiner. When you're moving up to the next station, again, don't forget to say thanks. So these are certain things which are like, they are assessing you at your confidence, that how shaky you become and how nervous you become when it comes to stress. And you have to show to them, no, we have been practicing. It's our daily routine. I won't say that you would answer 100% of the questions, but it should not affect your communication, speaking flow. Because when you start fumbling and when you become silent, that shows that, yes, you're nervous. And you have to show to them that we are all ready. We have been practicing this. If you don't know an answer, that doesn't matter. We are going to read it and we are going to reproduce. But at that point in time, stay confident. Right, Rack? They don't know what you've been passing through. They don't know that you had ill health. It's only what you're going to present out there. Okay, my dear? Yeah. And just stay confident. Yes, my dear, please. Yeah.
Even if like they give me a station like what I'm mostly worried is about the short station. Like if something comes and like I blank out, at least I can do the general history template and the general recommendations, like weight loss, the folic acid, the aspirin, those kind of things,
Yes. Yes, this is what we are trying to say, that you might be blank in the core knowledge of lupus nephritis, but you would not be blank in the outline of the station, because that stays the same.
Yeah.
So none of the station is going to be like, flat zero. It cannot be, provided you're speaking something.
Most importantly is like to identify like if it's a renal or whatever endocrinology problem, like always, I think what they like is to stay safe and to refer the patient to the concerned department, and that it will be an MDT with ourselves and the renal or endocrinology or psych team, whatever, isn't it, Chin?
Yeah, exactly. Yeah. This is what I mean to say, that you know the things. It's not that you're going to be blank. just stay confident, stay calm. It's going to be a chit chat just like that. The way you have been practicing, the way the long cases Chin have been doing, the way you people have been practicing with me in the circuit, it's just going to be one more day of practice, right?
Okay. Okay.
Yeah. Yes, Buthaina, how are you feeling? The Rak has shared her feelings. I hope you're not very tired.
Fine, ma'am.
Hello.
Hi, ma'am. How are you?
Hi. So finally, I think amongst the overseas, you are
Oh
one
my
of the
God.
lucky person to get the visa.
I cannot even till now believe it. How I
Serious?
backed myself.
Yeah.
Yeah, since yesterday morning, it's more than now 24 hours. I
Yeah.
just preparing my things. I was خلاص almost want to cancel everything.
I
Just
know.
nothing will happen. Save money as much as I can, honestly. And later they call me, come on, come. The visa it's released for you.
Yeah. And you know, Sarah in the morning also called me that what do I do? Shall I wait till morning? And today she emailed that I couldn't get that. And Ahmed in the study group that he was also passing through the same. And I was just talking to Chin the other day that we are helpless actually. We wish that, you know, RFA could help in that, but it's actually different countries, their own and embassy, their own rules and regulations. I know this is very unfortunate for those who had been preparing, but for you, finally you did it. Just make it a possibility to just pass. Give you 100% till the last, you know, circuit station in your long case as well. You've traveled so long, and the Almighty had made it like possible for you at the last moment. So we have to make it the best possible effort.
Inshallah,
All
inshallah,
right.
sure,
Okay.
inshallah.
So by the way, what's the plan for tomorrow? What are you guys going to do? And what should they do?
I am working.
Oh, don't tell me, right?
Yes. Her blood pressure is 180. So I came back.
Jane, would you like to comment on this?
I'm not sure which unit you're working in, but I think Prerna and Sadaf is in a better position. I
Yeah.
don't know how they did.
By the way,
Sadaf?
Dublin's really nice.
Yeah.
We reached Dublin, it's raining compared to Gulf country, the temperature 50.
Yeah.
It's quite cold actually.
It's quite
This part
totally
of the
different.
year, yeah.
So I hope you're not coming back the next day, Buthaina, yeah? So
Actually,
please
yes.
enjoy the next few days, yeah?
But I am going to be I practiced the abdominal hysterectomy today with my colleagues at work, and tomorrow I'm going to practice tonight I'm going to be done with the course of the ureter, the vag his, the cervical check,
Yeah.
and then I will take my Mrcpi copybook and I'll just fly through the pages quickly,
Yeah.
you know,
Yeah.
just like throw like a few minutes I on fertility, few
Yeah.
minutes I on, you know, PMS, on, you know, those kind of things, like just quickly fly through the copybook.
That's fine. I want to also
You will pass, inshallah.
you all would pass, inshallah. All right. So why Prerna and why Sadaf are silent? Sadaf, what's the plan for tomorrow for revision, please? Hello.
Hello, Dr. Sidra. How are you?
Hi, sweetheart. I'm fine. How are you doing?
Good. I was just listening to them. It was giving me some goosebumps as well, that what to do and what not to do. Obviously, it's a lot of course and all that, but still, thankfully, Chain was there, you were there, so it was great. Just going to go through all this trivia and small, especially the OSCE ones.
Yeah.
So just the important topics that are just like fluid, just like hysterectomy points and all these things. Obviously, we have been doing that, but still, they just run out of your mind. So we're just going to give a little bit of to them.
All right.
And hopefully keeping the nerves in the control.
Yeah, that's very important. That's the basic thing. So my suggestion would be for tomorrow, just scan your part 2 written Irish guidelines, all right? And then speak in terms of one structured discussion, examiner discussion, and one simulated patient task, and just revise the long cases outline. Okay, so give like 2 hours to this, and by evening, please stay calm and don't be sleepless. I want at least 8 hours sleep, and take something. This time, we were discussing in the morning, me and Chin were discussing that we have a very organized outline. All right, Chin, so what's the outline? It's just like everybody can see on the screen. Yes, Chin.
Yeah, so it's a very, I think it's very clear this time that you're getting two obstetric in the OSCE. I mean, okay, two
Yeah.
obstetric, two gynae, one communication, which will be a role. I mean, the role, not, I mean, it's more so of the, like, maybe a step of vagina hysterectomy or
Yeah,
step
examiner
down
discussion,
hysterectomy.
yeah.
Yeah, or maybe a bridge delivery, vagina bridge delivery, and the simulation will be something with a patient that probably breaking bad news or explaining the results to the patient, and labor ward prioritization. So,
So
that-
That
actually,
I can handle. If this much comes to
seriously?
it, I can handle.
Rack, you will handle everything. See, we have to be prepared mentally that what are we going to expect in exam, right? So you're going to have the OSCE exam in the morning, right? And your clinical exam in the afternoon. So I would request all of you to keep certain things in terms of like short snacks and juices with you so that you don't get drained. You're going to get something that will be really good, but at least you would be having your water, your juice with you, some sort of a sandwiches, please keep so that you don't get drained. And of course, it's a mental stress, so you are well hydrated in that situation, okay? Moreover, see 7 active stations in your clinical examination. 10 minutes each, you already have practiced reading and speaking in that situation. What you need to do is that you should be clear that there's going to be one role play in terms of a patient task, right? Whatever it is, please follow the general concerns. I would repeat again, acknowledgement, attentive listening, taking a history, but don't cut the role play. Listen to the role play, offering some sort of acknowledgement words. Yes, we are here to support you as a team. I can see that you're in a difficult situation. These type of words, basically, they want you to be empathetic. It can be a breaking bad news, as Shin is saying. It can be any sensitive station. Whatever it is, follow the general rules which I've taught you in the circuit, which you people know that these are the marks scoring points which we speak, and we are comfortable making the role player comfortable, and the examiner definitely is happy on that, right? So one simulated patient task in terms of the communication being tested, you should be perfect in the breaking bad news, take pauses, as I've done the IUFT with you guys. Just follow the steps, take pauses, and impress the examiner, and of course the role player is comfortable talking to you, right?
Tissue, water, and break.
Yeah. So take pauses and offer the vibes and give the tissue paper, and then you start again with permissions. So, if you're okay, can I continue? Would you like me to fix another appointment? These type of things, just don't forget the basics, okay? Labor ward prioritization, I've given you a perfect start. That patient safety is going to be my utmost priority. I'm going to assign the task as my colleague's competency, and you start with the life-threatening case, okay? Generally, they're not being giving more than 6-7 cases, so you can manage the time well. So speak and take care of the patient safety in the labor ward prioritization, okay? These 2 stations are must, which you're going to encounter. Now, 2 gynecology and 2 obstetric stations. Most probably, these examiner discussions are going to be from the Irish guideline. But if anything from the Green Top guideline, anything comes, stay very calm, confident, and whatever you remember in your part 2 written discussion, you can speak it up. I just want a confident voice. Don't be silent. It's your 10 minutes. And don't lose hope if one station goes, up and down, some sort of a below the average as per your assessment. If it goes bad, even then I want you to just forget it, and in the next station, please give your 100%. Reason being that every station counts, right? So don't say that, okay, one is gone, so my exam is just like now there's no possibility that I'm going to pass. It's nothing like that. So I want you to stay very calm and confident in this until the last station. You're going to have this in your mind that, yes, if I pass the station, I would pass the exam. You are going to that circuit and the long case with the passing attire, please. And with that thing in your mind that, yes, it's just another day of practice. Nobody's analyzing you. They just want to see our confidence, check our confidence, and we would ace it just keep the basic things in your mind. Don't make a big, a blunder. You just follow the pattern and you would very easily pass this exam, right? So you know the outline, you know the pattern. It's just like you just have to believe in yourself and be optimistic, and you all have the ability. If somebody is traveling and is tired, if somebody is having some sort of a sickness or illness, they don't know that. It's only what you produce on that day, what you speak on that day, what you represent on that day, right? So we have to be prepared mentally. That is just like you're talking to your supervisor, you're talking to your senior, and you're talking to your colleague about the topic. Only confidence is what would make you pass in the exam. And if you're going to start fumbling, if you're going to stay silent, and if you're going to say, sorry, I don't know anything, of course, the chances would be less. So I don't want that level to come, right? Yes, Jane, what do you want to say to give them complete booster and the confidence how they're going to be better?
I suppose again, you just have to, like I said, just have to stay very composed, stay very calm, and deliver and do your best, and the examiner is there to prompt you and help you and guide you as well if you are lost. And if you're not sure, just ask them to repeat themselves, ask the role player to repeat themselves. So I don't think you should be shaky about it, and you shouldn't be feeling intimidated by them just because it's you are playing a role here, and they're putting on an act there. So you should be just acting as if you are talking to someone in your daily clinic, your routine practice. Yeah.
Mm-hmm. And there are certain things which I've already told you in the examiner discussion, that if you don't understand a question, you can definitely say, so can you rephrase that for me, or can you repeat that for me? They definitely help you. They speak like one or two more lines to elaborate that and expand on that, so that you understand that what do they mean and what do they expect from you as an answer. Right? So don't be shaky. It's just like, for example, if I'm asking you a question, Chin is asking you a question, you people understand that, okay, we are answering this because we're prepared. The only thing which makes you fearful that day is that would we be able to give our best? So you have to tell you that you would give your best, only stay calm. OSCE is all about having a good control upon your nerves. That's it. So if you have it, and you have been practicing earlier, nobody is blank on anything, I know. It's only that how you deliver, right? Okay, so I think Prerna have been silent. Hello, Prerna. Why silent, my dear?
I was just listening.
I can understand that this time is that when listening gives you more power, but how do you feel? And any query, my dear, anything which is bothering you at the moment?
No, the nervousness is there. The butterflies are there. I guess like the prep for the OSCE is different to the prep for the written.
Correct.
So like while we were doing the written, you could just sit in a corner in your house and just cram and cram and cram. Like you can't do that for the OSCE. So like you spend a lot of time thinking, how do I prepare for the OSCE, as opposed to actually preparing for the OSCE. So like the sessions helped a lot, because then you could like speak to the patient, summarize. So like speaking out helped. The sessions helped. I think we've gotten out of the practice, because in med school, we'd just stand in front of a mirror and we'd do it. So, because we do it every day, we don't do it now.
So Prerna, tomorrow my expectation is that just revise all the bits in terms of the basic patterns of all modules. Okay, so that the revision is there, and do revise the Irish guidelines, just in, scan up the recommendations and the basic points of your part 2 book. Okay, the notes. All right, so this is my expectation, so that you people are fresh. So I think many of the students, they couldn't join Chain because of traveling. I think the Sam is yet to reach. So she would bother you.
Is supposed to keep in touch with me, because I'm in Dublin tomorrow. So I'm not sure if Bhutana is free. Maybe we can catch up for a cup of coffee or tea or something like that.
And do take But Hannah, go catch up Chin, and he's going to take your long case, mock prior to the exam. Yeah, catch him.
Okay.
I think Rock
Thank you, sir.
Adolf
And
Brenda
he's
is-
going to, he's going to, have this. He's saying that we'll meet over a cup of coffee. I would say that it would be a long case and one simulated patient task, and then definitely make her have a coffee, Chin. Okay?
I have a question I wanted to
Yes,
ask.
Kat. Sure.
Yeah,
Please.
you know the short station where we have the 2 gynae and the 2 obstetric cases.
Yeah.
So it's 10 minutes, but like let's say it says do history taking and present the case. Like I need to finish that before the 10 minutes because they will want like a few minutes to ask me additional questions. So I can take my 10 minutes to do whatever is asked in the station, or I need to leave a few minutes kind of window for them to ask me more questions.
I suppose read the task on the table. What is being given to you? If it's just about information gathering, yes, you will have to ask some amount of history. Then usually it will be explaining the situation or the task to the patient. And in these circumstances, the examiner is not allowed to talk to you if there's a simulated patient in the station.
So
Yeah, so
Chin,
it's-
she's asking about the long case timings.
Oh, long case, is it?
Yeah,
Sorry.
yeah.
No, not the long
Not
case.
the long case?
The short case, like
No. In the simulated patient task, they're observer only. They
Mhm.
cannot talk to you.
Yeah.
Okay, so I have 10 minutes start.
Like we did the simulated patient task. So you're going to start that. Hi, I'm Dr. Rak, one of the doctors in the antenatal care clinic today. So may I confirm your name and age? And you just start talking. So the examiner is just observing. So till the end, thank you for your time. And this is a patient information leaflet. I'll connect you to certain groups for your support. So whatever you're going to say. So from the start. Simulated patient task is only the examiner is observer. It's only the long case where you
I can use my full 10 minutes.
Yes. Simulated patient task, yes. And when you're talking about the examiner discussion, he himself would prompt, or she herself would prompt for the questions. Okay.
But that's the simulated. That is the simulated task where there will be me and me talking to the patient, and the examiner is only observing.
Yes.
But you know that I'm asking about the two gynae and the 2 obstetric cases that we're going to have.
There's not going to be any patient as a role player there. There, the examiner would have these certain questions. After you read your candidate instruction, they're going to ask question, you answer that question, and the next question, then you answer the question. So it's like a discussion with the examiner. There's no patient, and you need not be like present yourself as a
for example,
there you would be a candidate for exam.
Okay. For example, hysterectomy can come there.
Yeah, hysterectomy, the vaginal abdominal hysterectomy steps can come there. The post-voiding that retention problem, that's going to come there. The voiding problem is going to come there. So all these epilepsy is a station that comes there. Okay, so these type of discussions.
And Chin, remember I asked you this question. I did not really get it very clear. What about a clock? Will I see a clock?
No, basically there will be a timekeeper in the center of the examination hall. So you see a guy standing directing all the candidate into the cubicle. So he or she will be watching the time, and when the time 1 minute before time, he will give you the warning. And then once the time is up, then he said, you can move to the next, prepare to move to the next station and wipe down the station.
Okay.
Yeah.
Okay. And for the long station, the 25 minutes, I have to keep like 10 minutes for them to ask me questions.
Yeah. So basically, once you have speak or take the history from the role player, which is at the corner of, which is on usually at the side of the examiner to the pair of the examiner, then the examiner will ask you, are you ready? Are you done? So that means that, the time is over. Usually, generally, we'll say about 2 minutes for that quick history taking. And then he or she will ask you, like, can you summarize your history to me in 1 sentence or in 1 minute? Yeah. Then you can. Then after that, you can proceed on with the discussion with the examiner.
Okay,
And-
so for the long case, I take 3 minutes for the history taking.
Yeah, generally 2
And
minutes would be advisable. Yeah,
oh my God,
yeah.
3 minutes, 3 minutes, and then summarize it to him, and then we will move on together. And then he will tell me, okay, he'll show me an ultrasound picture, or he'll tell me to do a
Yeah.
bimanual vaginal examination. Then it will be together.
Yeah, exactly. Exactly. It's just the first 2 minutes to 3 minutes that you're talking to the role player. That's it.
Okay.
And
And what
basically,
happens if I've taken more than 3 minutes?
The examiner will stop you because, in the interest of time, you need to progress on to the next part of the exam, because there's no point dwelling 10-15 minutes on the history taking if you are not able to examine the mannequin and you're not able to come to the structured discussion part. So there's no, the examiner will be quite mindful about the timing. So he or she will, tell you to move on.
Okay, so for the long cases, not for the short cases, I have my full time to do the history taking, 10 minutes with the actor. But in the long station, I have to take my 3 minutes only to do the history taking.
Yeah, generally 2 to 3 minutes for the history taking.
Okay.
Mhm.
Okay.
all right. Okay. So any other questions, please? Sadav, my dear, what are you going to plan tomorrow, and what is going to be the final points which you're going to keep in mind? Just do a recap for everyone.
So Dr. Sidra, as you have told, just go through the Irish guidelines for one more time, just a flashback in front of the eyes, just quickly go through that, and then do one station, give each like OSCE and long case 2 hours each thing, and then continue with that for the practice. That's all. And have a good night's sleep as well. Sorry if I
Yes.
took that.
Oh, no, nothing to be sorry. Nothing to be sorry. They're always welcome. So please take very good care, especially Buthaina, when you have a change of place and the clock is changed as well. It's very difficult. And of course, the jet lag is also there. So please take care of the sleep from tonight only, so that tomorrow you are basically in the same cycle. All right. Rak, also, please, I know that you're always sleepless before the exam. So please, at least 8 hours for me, so that you people are fresh in the OSCE and there's no confusion in terms of having this nervousness in OSCE. Okay. Yes. All right. Okay. So thank you, Buthaina. Thank you very much, Sadav. Thank you, Rak. All of you, please take very good care of yourself. And we would be just active in the study group. If any concerns, anything you people want to discuss, definitely you people can just write down there. So last words and last booster from Chin's side, then we are going to call it a day. Yes, Chin.
Again, my best wishes to everyone. I know all of you has all what it takes to pass the exam, and this is a very exclusive membership and club. So myself and Dr. Sidra, will be very, very eager to see all your name on the pass list, hopefully in the next 2 to 3 weeks from you can do this and believe it, the success will be yours.
Definitely, yes. Rak has a question, what kind of attire to wear? Rak, it's always preferable to wear anything which is like semi-formal, any straight pants or some sort of a blouse or a collar shirt. Don't make it like very funky or a floral or some sort of a bright colors. So anything which makes you comfortable. Of course, the shoes should be very comfortable because you're going to walk a lot. I mean, it should not be a type of a dress which makes you uneasy. At the same time, it should be a decent looking. I would suggest anything like in blacks or anything in whites or anything in like peach shade or pink, but it should not be like floral or very bright colored, like very heavy prints should not be there. Okay, so yes, please wear something like semi-formal dress pant or a straight trouser, don't wear casual like a t-shirt or a jeans, right? Like Chin is saying. Okay, so okay, Butaina says brown. I hope this dress comes out to be lucky here in the OSCE as well, Butaina. Thank you very much. Thank you. Inshallah. Lots of prayers, my dear. Thank you very much. As Chin has said that you all are ready. The only thing which we are here to tell you is that you are ready and you're prepared for the victory and passing. People who had been preparing early, the people who had been appearing early, they were just like you. And let me tell you that as compared to other OSCE exams, specifically Mrcpi Part 3, passing of OSCE rates are higher in Mrcpi. You people are going to be less because many could not turn out to appear in exam. You can see just your study group and your study batch that you know how less could just finally make out to turn for the final exam. So the chances of passing is definitely higher. What I expect from you is that have faith in yourself, believe in yourself, make it a possibility thinking only about passing and do not think about failure. From tonight onwards, we all are going to think about passing only. No fear of failure. You are going to reproduce whatever you have been practicing. Just stay calm, confident, and give your best shot out there. Whatever is going to be difficult, that will be difficult for everyone. So staying calm, composed, and confident is what our suggestion would be. That's what our expectation would be. Make us proud. RFA would definitely be praying for you guys. We would stay active in the group on your exam day. Please stay in touch and keep us updated. If you need any suggestion, anything, you can simply ring me or Chin, and tomorrow catch up Chin for the discussion and of course the cup of coffee. So this is what we can offer you, and all the very best. Anything required, we would be sending the last minute voice note, what you people have to hear prior to going to the exam. So I would be ringing in your ears the way you people had gone to your written exam and you just passed it. This is the time when you have to be successful in the final step of your Mrcpi. Lots and lots of love, lots and lots of prayers. We would make it a success together. Thank you very much. Good luck and best wishes from the entire team of RFA Tutors. We love you all. Take very good care of yourself. Bye-bye from Chin and bye-bye from my side. Thank you. See you guys.
Thank you so much, Jen. Thank you so much, Dr. Sidra. Thank you.
Thank you, sweetheart. Bye-bye, everyone. Thank you. Bye-bye. Good luck. Thank you, Chin. See you, my dear. Bye-bye. Thank you very much.
Bye-bye.
Bye. Bye-bye.